Hey guys, it's Dr. Jen. This is my first live, so bear with me. But I wanted to hop on today to answer some frequently asked questions. So first of all, for those of you who don't know me, I'm Dr. Jennifer Bellingrodt. I'm a licensed clinical psychologist of over 20 years. Currently have a practice in Arizona, but I can see people in most states of the United States. I was formerly a military psychologist and now in civilian sector. So I work primarily with personality disorders and also work with some couples. I only work with adults. I don't work with children. I'm going to talk more about the populations that I work with in a minute, but let me just say thanks for joining. This is exciting and nerve-wracking at the same time, if I'm being honest. So I'm just going to go through some frequently asked questions, as I said. So the first one that I get asked a lot is, what's the difference between a psychologist and a psychiatrist? The main difference is psychologists, therapists, counselors, social workers do talk therapy, and psychiatrists do prescriptions. They do medication management. There are a few psychiatrists who will do like slightly longer sessions and try to work in some therapeutics skills or some CBT, cognitive behavior therapy, something like that. They are few and far between, really, because their appointments are generally 15 to 30 minutes. So there's not really a lot of time to get into the muck and the mire of therapy and really helping someone, unearth their issues and get to the bottom of those. So psychiatrists do med management, psychologists do talk therapy. When I was in the military many moons ago, there was a program where they trained, I think it was like 10 psychologists to also prescribe medication. So if you can find one of those, if they still exist, then that would probably be the exception. Okay, next question is, if I have family and friends to talk to, do I need a therapist? Well, it's up to you. The best part about having a therapist is it's someone who's objective. They're on the outside. So your friends and family very often will tell you what you want to hear, or they'll try to be just supportive. Now, some friends are very direct and they'll just call it like they see it. Those are the best. But in general, they're on your side. So when the rubber meets the road and you really need some information or you need to be confronted with something, they're not necessarily going to be the ones to tell you that. So a therapist is someone who's more objective and on the outside. You're also working with someone who has been trained and gone to school and has experience working with other people, seeing a lot of different types of people, and they can give you skills and different things to try. They can apply different therapeutic modalities. So there are a lot more options when you're talking with a therapist versus just a friend or a family member. So the next one is, how does therapy work? So the primary goals that I work with people on when they come to me, just in general, it varies by person, but the primary goals are to overcome whatever you're doing that's not working for you. So what we're doing is we're looking to do things like change your perception and teach you how to do things differently. So my work is primarily with personality disorders and specifically with BPD, borderline personality disorder. So there's a lot of skills training. There's a lot of rewiring nerve pathways in the brain by practicing new skills, learning to process information differently, and so on. As I've said before, I see BPD as an information processing disorder. So information comes in and the person responds to it in such a way that they then behave in ways that don't work for them in the long run. They work in the short run sometimes, and then some people with zero insight who have BPD would say that their methods are working for them all the time. If they land in my office, though, it's because something's not working for them. And so we're going to work on perception and then changing or applying skills in different modalities to help a person develop skills so that they can approach the world and the people in it differently. So the specific therapy goals are going to vary, from person to person, but that's the gist of it, is working on changing perception. A lot of what I do is boundaries coaching and helping people understand how to set boundaries, because that is particularly challenging for a lot of people, and especially for women, I found. I actually have a training that's devoted to women and boundaries that I can discuss, separately, but it's such a big issue that I built a training around it so that more people could access that. And it's available on my website if you click the link at the top of my profile. Okay, so with what age groups or populations do you work? Again, I work with adults only. I stopped seeing kids many, many years ago and just focused on adults and personality disorders. I wrote a book about marriage, so I work with couples quite a bit. What I don't work with are things like pedophilia, addiction, and eating disorders. Addiction including drugs, alcohol, any sort of addiction. And the reason is these are subspecialties in psychology. So I will refer those people out. I'm not an expert in those, and it requires expert treatment, in my opinion. So I will refer those people out. I stick to my lane as best I can. All right. How often should I schedule an appointment? That's another common one. So what I tell people in the beginning is, look, we've got work to do, okay? You finally made the decision to come in. Good on you. Let's go. Let's hit it hard. So coming in once a week is generally recommended. I have had people, particularly with BPD, who are in a great amount of distress. They come in multiple times a week to start with. But I generally recommend once a week. Why? So that we can get moving, so that we can complete the intake process, which can take multiple sessions, particularly if there's trauma. Then that might take even longer to unpack all of that and get a handle on it. The other thing is we want to get you some relief. So let's, like I said, hit it hard and really jump in and invest and help people and help you get some relief from whatever it is that you're challenged by. And then the other thing is it kind of keeps you accountable. So it's enough time for you to do your homework, but it's not so much time that you kind of forget what you're doing. Now, some people, because of scheduling or cost, or they just don't want it, they don't want to do once a week, and that's totally fine. All I say to them is, okay, let's do every other week. Some people can only do once a month. That's fine. Whatever you're willing to do. I'm just glad you're working on yourself. If you're in distress, I'm glad you're getting some help for that. So we're looking at then, in that case, the process is just going to take longer. It's no big deal. And then you're going to have more homework between the sessions because you're going to see me once a week, once every other week, once a month. There are so many hours in between that you really need to be doing the work. So that's what we're looking for, is what's it going to take for you to do the work and be consistent and stay accountable. So normally I recommend weekly, and then we just kind of stretch it out as we go along and as you feel healthier and more able to handle yourself in ways that you prefer out in the real world. Next question is, do you take insurance? I did for almost 20 years, actually over 20 years. And I just, quite frankly, couldn't afford to do it anymore. That's a separate discussion, but I stopped taking insurance of any kind in June of this year. So I do have cash rates available. Intakes are 200, follow-ups are 175, and you can, again, schedule that however you want to. And then what a lot of people do is they get a super bill. It's a couple clicks of a button on my electronic medical record platform. I send you the super bill, and then you can submit that to your insurance if you have out-of-network benefits. Then once you meet that deductible, then maybe they kick in a little bit and help you, help offset the cost. So no insurances. I did it for a long time and I won't be doing that again. It's a nightmare nowadays, quite frankly. Okay, where can you practice? So I have a virtual practice, thank you COVID, and I can practice in most states in the United States. If you want to see if I can practice in your state, you can go to psypact.org, PACT.org, and you can get a list of all of the states that I am credentialed in to practice. Now, I'm licensed in Arizona, so this is a reciprocal arrangement that was created during COVID where psychologists, because everything was going virtual and we were no contact, psychologists, we had people fighting for us, advocating for us, and we are now able to see people in all sorts of states. There are a handful of holdouts, but you can see the map on psypact.org if you're curious. And then how long does therapy take? So it depends. The couples therapy and the personality disorders therapy take a longer time because usually with BPD, we're unpacking a lot of trauma. As I said, that takes a lot of time. We're going to do the trauma work. We're also going to be doing DBT and skills development. And then couples work takes a while because by the time two people have come to me for help with their relationship, there's a lot of water under their bridge. And so there's a lot going on that we have to really dissect and get to the bottom of. And then teaching, new skills, new ways of communicating, those types of sessions tend to take longer. So if it's something like grief over a loss, or if it's like a life transition or something like that, then that's going to be quicker. That might be a handful of sessions or maybe a few months. Whereas with personality disorders and couples, sometimes that's a lot longer. It could even be years with BPD and other personality disorders, depending on how much trauma there is to unpack and work through, because that trauma work has to be done first. It has to be resolved in the mind and compartmentalized in a healthy way. I'm not trying to make you forget it. That's not possible. I wish it were. But the compartmentalization process takes quite a while. And then my approach is just a psychodynamic approach, which means I'm going to do a deep dive into your history, your family of origin. We're going to look at everything that happened to you up until the point we sit in front of each other, because all of that stuff can affect you. And what we know from the research is that things that happen to us before the age of 6 are particularly impactful. Why? Because we're in a brainwave state known as theta. So there are different brainwave states. Theta is the one that we're in if we're meditating or if we're hypnotized. And so you have to think about someone being very relaxed and very open to influence. Very sort of malleable, if you will, in the brain, speaking to the subconscious, that kind of a state. So we're very easily influenced, and that can affect behavior. And when you're a kid, it's even stronger because you're looking to these people, these adults around you, to figure out how to behave, how to think, how to feel, how to respond, how to handle things, and so forth. So before the age of 6, if there's trauma, that's particularly impactful. Not to say that things that happen after the age of 6 are not, because they most definitely are, but just what we know from the research is that that's a particularly challenging or influenceable time for people is before the age of 6. So we're looking at all the deep dive into family of origin, looks at all of the trauma, all of the good, the bad, the ugly, everything in between, and we're working on trying to unpack and reframe and compartmentalize that in a healthy way. Not forget about it, because we can't, but store it in a healthier way. So other questions that I get are related to the specifics of what I do. So borderline personality disorder is my specialty. Been doing it for a very long time, seeing a lot of people get as close to a cure as possible without saying that, because technically there's not a cure. But in terms of wondering whether you have BPD, I have lots of videos on my page about the diagnostic criteria in the DSM for BPD, and then the BPD symptoms in real life and what that might look like. So I see a question about that. So basically you're looking for a personality pattern where there are issues in various settings. So it could be occupationally, it could be in friendships, it could be in romantic relationships. It's kind of across the board. Now, some people will find that they do okay in their other relationships, but in the romantic one, that is the most challenging. That makes sense, because romantic relationships should be characterized by some pretty positive, intense feelings, sometimes negative feelings or altercations, disagreements, whatever. So sometimes those issues can be triggered. But basically, we see things like impulsivity, we see abandonment issues that come out of different insecure attachments. We see mood lability, so very reactive mood to things that maybe other people on average wouldn't have such a big reaction to. Because they trigger something within the person with BPD, then there's a much bigger reaction. Someone asked about remission. Is it possible? Yes, it is. I agree. So I think that I've worked with a lot of patients with BPD over the years, and I have plenty that, there were some that were coming in multiple times a week, and now they're coming in pretty infrequently. And it's just kind of a maintenance visit where we're like, okay, what are some things that you reacted to? What did that look like? How did that feel? Okay, which skills do you need to be tapping into? Or do we need to work on kind of honing some skills or refreshing some skills? So it's one of those things where you definitely can get better. I wouldn't be doing this for 20 years if you couldn't. I wouldn't keep coming back if I didn't see people getting better from the work that we're doing together. And what you need is a very motivated patient. You have to be ready to work. It is not going to be fun. It is not going to be easy, but I'm here to tell you it is absolutely worth it. I love doing the work of helping people see that life doesn't have to be this way. There's a different way that you can function. There's a different way that you can feel. And it's all about changing the way things occur to you. So again, information processing disorder, we're going to change the way things occur to you so that then your thoughts lead to feelings and behavior. So if we change the way things occur to you, then your feelings and behavior are going to be different coming out of that. So remission, yes, possible. There may be some upticks, and basically what I teach people is, okay, you're going to experience some of these things throughout your life, and so these are the skills, that you need to get really good at, and then you just pull those up. So I'm looking to see if there are other questions, excuse me, other questions that I maybe can answer. That was everything that I had written down about frequently asked questions. So any other questions that you guys would like me to try and answer? Some may be appropriate for this venue and some may not be. But tell me if there are other questions. Let me go back. This is all new, so bear with me, you guys. Remission, yes, yes. Your videos have been helpful and I have learned a lot. Thank you so much. I'm so glad to know that my efforts are helping other people, right? That's what I do this for. Walking on eggshells was an enormous help for me dealing with family with BPD. Amen, sister. That is a really good book. Stop Walking on Eggshells. It helps you learn how to deal with people with BPD, help handle the situations, do things to not escalate or provoke, because that's just inappropriate, quite frankly. Hey, Adam Principal, how are you, man? Love your information. Thank you so much. Prices, I mentioned those earlier in the video. An intake session with me is 55 minutes, and that is $200. A follow-up session is 45 minutes, and those are $175. All right. Recognize BPD in ourselves and others, specifically significant partners and children. I would say go back to my BPD symptoms IRL series. Go check out the BPD symptoms checklist from the DSM, which is the clinical manual that we use to diagnose mental health conditions, and see if you can get some information from that. See if you check any of those boxes. I did a video way back when, it's actually pinned on borderline personality disorder. And so that has really resonated with a lot of people because they talk about actual things that people with BPD might say to themselves. So that might be helpful. I see messages and I'm not sure quite how to do that. Again, bear with me, you guys. Let's see. Oh, tips to calm anxiety before an operation. I cannot deal. Okay, that's challenging, right? Because you're going under the knife, you're not in control, and the antidote for anxiety is control. So what we want to do about that is we want to do everything we can to control what we can. We can't control the surgeon, we can't control the OR staff, the nurses, stuff like that. But you can control what you have power over. So there are a lot of things. It's probably a whole video into itself. But one of the things that you can do is stay away from stimulants, caffeine, nicotine, substances that are stimulating, energy drinks, all of that stuff for at least the day before. Generally, because caffeine can be a blood thinner, they want you to stay away from it for a while. But caffeine can approximate the same physiological arousal in the body as anxiety. And so you want to stay away from that. Plus, it stays in your body for several hours, sometimes half a day, depending on the person and how much. And so that can amp up your anxiety. For me, before I have something major like this happen, I do a lot of prayer. I ask other people to pray for me. I will ask the doctor to pray with me or ask me, let me pray over his hands. So if you're a believer, then that's something that you can do. You can implement meditation. You can do deep breathing. You can talk with your providers about maybe supplements that can help you get a good night's rest. If you're not getting a good night's rest, I can't speak to those because I'm a doctor but not a physician, but you can talk to your providers, your medical provider about that and see if there's something that can help you sleep. Writing. So there's something chemically magical, for lack of a better word, that occurs when we put pen to paper. So you can do some writing, you can do some journaling, just kind of get those thoughts out. Along those lines, you can also talk to someone else about those thoughts, whether that's a confidant, friend, family member, spouse, partner, therapist, whatever. Talk to somebody about those thoughts. Sometimes just calling it out, calling it what it is, putting a name to it, gives you some control over it. So anything you can do to get organized, to be prepared for when you return home, to be prepared for that morning, all of those things are going to help you gain some semblance of control, which is that antidote for anxiety. All right. I see roses and hearts, and thank you guys. I don't know what that means. I will unpack that after I'm done. But thank you in advance because I'm sure it means something special. Mia, you're so sweet. Brilliant woman, such insight, such a blessing. Thank you, girl. I appreciate you. Type of expert I'm in need for. Okay. If you want to work with me, I've done videos about this before, so you can go back to my page. But if you want to work with me, the way that looks is you're going to message me just right here in TikTok, and I'm going to want to know how old you are and what state you live in to make sure that I can see you. Once we figure that out and we're good and check the boxes, then I'm going to direct you to my website, drbellingrodt.com. And there's a new patients tab there. You're just going to click on that, read through that information, and then there's an inquiry form at the bottom. You click on that, takes you to an UpDocs form, and you complete some basic information. That goes to my staff, and then what they do is they put it in a spreadsheet for me so I can see, so I can double check that everything is good. It's a condition I treat. You're of major age, you're not a minor, and you live in a city or a state that I can treat in. And then my staff, once I give them the okay, the thumbs up, then they will call and get you scheduled. All right. Thanks, Mia. Please watch her videos. Amazing. Okay. BPD is so exhausting. Yes, girl. I know. I see it every single day. Do people commonly misdiagnose, I assume, autism for BPD? I've been asked that quite a bit, and I don't see a lot of autism in my private practice working with adults. So I would really want to do a lot more research before commenting on that. I imagine it can happen. I mean, bipolar and BPD are often misdiagnosed or confused. So I think there are some characteristics of autism in terms of maybe some of the reactivity, the challenges with change, maybe some social issues. I could see there being some overlap. So it is definitely possible, Maddie, to answer your question. Okay. I wish you could be my therapist. Message me. Let's see if we can make it happen. I do have openings. Summer is a slow time, so I do have openings in my schedule. You're live. Mia, you're so sweet. Thank you for sharing your videos with your provider. All right. I have no. Okay. Abigail, I have an appointment with a psychiatrist on the 19th. Okay, so psychiatrists do med management. They don't generally do talk therapy. I am not against medications. I believe in better living through modern chemistry. Absolutely. However, I do think when it comes to personality disorders in particular, if that's what you're talking about, Abigail, I don't know. But that is what I'm talking about as my specialty, so I'm making an assumption. But talk therapy is going to be necessary as far as I'm concerned with BPD and with a lot of conditions. So a lot of conditions can be helped by medication. The symptoms of BPD, anxiety disorders, bipolar disorder, schizophrenia, mood disorders, lots of things can be helped by medication. But where we see the best impact or the best effect is when medication is not used in isolation or used alone. When you can get therapy in addition to that, then that's the winning combo. And not everybody needs medication. Like I said, I'm not against it, but it's true that not everybody needs it. And I have some colleagues who they do a lot of supplements, vitamins, minerals, different things like that to help with some of the psychiatric conditions as well. If you're in Arizona and you need a prescriber, message me. I can give you one of the best prescribers I've ever worked with in doing this for over 20 years, military and civilian sectors alike. She is top notch. She can only practice in Arizona currently. So make sure you're in Arizona if you hit me up for that information. But Abigail, proud of you. I'm so glad you're going to go get this figured out, girl. That is awesome. Is it my BPD that makes me sad and depressed when I look through sad TikToks? It could be. I mean, you could look at any person without BPD could look at sad TikToks and feel sad. If it impacts you in a very, very big way, and like you mentioned, it leads into depression, then it's something worth considering. But I think there are a lot of sad stories out there on TikTok and other social media platforms, in the news, you name it. So just getting sad after watching something like that doesn't necessarily mean that you have BPD, or if you know you have BPD, it's not necessarily that's driving it. I feel like people with BPD, though, tend to be more attuned, more emotionally attuned. They're more emotionally sensitive and more emotionally aware, which is a good thing until it's not. So I think if you're experiencing that pretty deeply or pretty richly, the emotion, then it could be a function of that, or it could be that just you're just a human who's watching something really sad and you're going to be sad for a time. Very reasonable question, though. Thank you for what you do. Okay, good. I'm glad to hear that it's helpful. Thank you. I appreciate you guys bearing with me. Like I said, this is my first live, so it's kind of nerve-wracking. Thank you for your content. Absolutely, Abigail. My pleasure. I love doing this work. Love it if you guys would share the content as well, because I do want to start that subscription service that I mentioned. Apparently going live helps with that equation, so that's one of the reasons I'm on here today. Okay. I see messages. Let me look at some more comments before I head out. All right, answered that. I'm going back to the bottom now. Sorry, I know this is making my phone shake, and that's really annoying. Talked about remission. Accidentally cheated, my man. Oh, sorry, no such thing. That you're going to want to unpack that with somebody. I can't really respond to that because I don't know your circumstance or your situation, but I don't think that kind of thing is accidental. It's not irreparable. I mean, when I work with couples, so you guys know I wrote a marriage book. When I work with couples, couples who go through infidelity, more likely than not, they stay together than split up. So, it depends on the circumstances. Again, I don't know what's going on, but if you've got like family invested, things like that, then it's definitely something worth working on. And, see if you can't reconcile, do some couples therapy. You don't have to be married to do couples therapy. So see if you can work it out. Okay. Cancer. Oh, Jenna, God bless you, girl. I hope you can beat the cancer. I'm on your side. All right. Okay. I think that's it. I'm sure I'm missing some, so I apologize. We talked about some anxiety. Oh, no friends on purpose. I was going to comment on that. Yeah, sometimes with mental health conditions, particularly personality disorders, people just choose to kind of retreat and stay away from social interaction until they can develop some greater skills for emotional regulation, distress tolerance, things like that. So I understand why you're making that decision. I don't want you to stay there very long because social support is the best protector against psychological distress that we currently know of. So I would like to see you get some support eventually. Don't stay there too long. Okay. Thank you, Ryan. I appreciate you. All right, guys. I think that will do it for today. Oh, okay. All right, Reese. I see you. How do I explain how I'm feeling? It's a good question. So Reese is asking, how do I explain how I'm feeling with BPD to my therapist when I don't even know how I'm feeling? So, couple things. I think if you can write between the sessions about what you're feeling, as best you can articulate it, that's the best you can do, is just get some words on paper, and then take that to your therapist. So I've had patients who will write between the sessions, and then they bring they print out a copy. This was when we were in person. Now you'd email it or whatever, but they bring a copy of their journal, and we go through line by line, and we hit on the things that need to be addressed and that kind of thing. So sometimes just sharing your journal, if you're willing to do that, is good. The other thing is, if you're not sure if you have a diagnosis of BPD, I've done videos about this too for more information, but ask your provider to walk through the BPD criteria with you. It's 9 simple criteria. They can walk through those and to help you discern if that diagnosis is appropriate or not. And you can give them examples. So criteria 1, okay, they read you the criterion, and then you can tell them, hey, here's what I think applies to that. It should be an open exchange with your provider. They shouldn't be shutting you down or be so narcissistic that they won't even listen to your opinion or the opinion of someone else. But explaining how you're feeling with BPD, I think that maybe the journaling would probably best help. Or sometimes what people will do is they'll make notes in their phone about experiences that they've had. And then when they come in, we unpack those specific experiences. Okay. Do you think it's helpful to tell a friend they might have BPD? Ooh, that's tough because there's so much ignorance and stigma. Talking to you, Crystal. There's still so much ignorance and stigma attached to BPD. It drives me insane. It depends on the friend, depends on your relationship with the friend. You do want to approach it gingerly, and you approach it from a position of, these are my observations and here's what I'm concerned about. So my concern is, or I'm concerned about you, or, hey, I saw this video. If you're willing to take a look, I think it might be helpful. It really depends on the relationship. I mean, I have some friends I could say that to, and I have some friends that, I take me being a psychologist out of the equation, but some friends I could say that to, and some friends that I probably wouldn't say that to. So it really just depends. Okay. Why do I black out when I'm having my episodes? It's hard to say without an evaluation. I think you have to get a thorough evaluation that looks at your history, the context in which these things are occurring, what kind of patterns you identify or you observe. And sometimes that's the beauty of therapy, is therapists can help us point out patterns and look at, how the history is relevant and so forth. So if it could be that you're dissociating, it could be depersonalization, derealization. It's hard to say. So I would definitely get an evaluation with a licensed psychologist. Generally, you guys have probably seen me recommend a licensed psychologist over and over and over and over. Why? Well, as psychologists, we have pretty extensive training in the different forms of what's called psychopathology, or what's referred to as abnormal psych. Nowadays, it's not abnormal for people to have mental health conditions, so we probably need to rename that, to be fair. But I think that psychologists have a lot more training and education in that, and then a lot more experience dealing with more difficult cases. Not to hate on anyone who's not a psychologist but is a therapist. Please don't misunderstand. Social workers, counselors, therapists, these people are wonderful. I have friends, colleagues, they are wonderful. But I will tell you, they all refer the personality disorders to me. So that's why I generally recommend, if you think it's BPD, you want to find someone versed in personality disorders. If you can find a therapist, counselor, what have you, social worker who has that experience, that's fine. I just kind of default to psychologists because of the amount of training and experience that we have with, again, what used to be called abnormal psych. Ayahuasca, yes, I have heard of that. I don't know a whole lot about it. I know I've had friends and patients experience it, and they feel like it's helped. You have to be really careful, because for some people that makes all of the trauma come rushing back at once, and that can be really overwhelming depending on what your history is. So I can't really recommend it because it can be really, really scary, but I do know people have used it. Let's see, let me hit a couple more of these. Wonder why, though, the person, oh, hey, Ashley, the person evaluating me and she hates to put BPD in my chart. Again, that's the ignorance and stigma. It's BPD has gotten a bad name. Hollywood has depicted it very terribly, and it's just really gotten a bad rap. And to be fair, there are plenty of people with BPD who are not getting help. They're hurting other people. They're violating boundaries, and that runs the gamut. But it isn't always like that. Okay. My experience with BPD is, again, it's my preference to work with people with BPD. So I think there's definitely room for improvement. A lot of people, because of that ignorance and stigma, the Hollywood portrayals, blah, 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 they're afraid to put BPD on a chart or on a person as a diagnosis because they think it's some death sentence. It is not. It is absolutely not. Y'all saw me do my rant video about this. Nothing makes me more upset. So I get it if they're trying not to label you or condemn you in some way. But again, I've done videos about this too. An accurate diagnosis is what we really need to get the best treatment plan. And the only way you're going to get better is with the right treatment plan for your diagnosis. So if there is a provider who thinks that you have BPD and they refuse to put it in your chart, okay, that's okay. What you can do is ask them to treat you for BPD or refer you to someone who can treat you for BPD if they're not versed in that. So ignorance and stigma, Ashley, those are the short answers to that question, girl. Oh, of course, you're welcome. BPD is so hard to live with. Preach, absolutely. I just want to be normal. Okay. Normal is a setting on the washing machine. Okay. Check out the video I just posted on Leave It to Beaver versus Shameless. What is normal and how do I get there? Plant meds over pharmaceuticals. Yeah, I agree. I mean, I prefer the natural remedies, the supplements. I have a functional medicine gal I work with personally for various things. So I always prefer the natural routes as well. Sometimes it requires medication though, and there is absolutely no shame in that, whether it's temporary or permanent. Yes, I have seen that, Ryan. The hardest mental illness to live with. I have Googled that actually, and BPD does show up. I mean, there are people with other severe mental illness that may disagree with that, but BPD is very difficult to live with. That's why it's this crusade that I'm on. Done research, you're a minor and think you have BPD. Okay, so I would say get a clinical evaluation with a licensed psychologist to help you sort out diagnosis. Yeah, that's probably going to be your best bet. Let's just see what we're working with. Let's see if this is really what's going on for you. So if you have insurance, you can go through your insurance and ask them to help you find someone, who's versed in personality disorders. And they can walk through those criteria with you. You can go in, I always want people to go in educated and armed with knowledge because knowledge is power. So if you think you have this going on, go in with having looked through the criteria and maybe written down some examples about why you think that applies to you so that when you're in there, you don't forget the things that you want to say. Going to a therapist is anxiety provoking. It should be. You're about to engage in life change and you're letting go of old coping skills. So it's anxiety provoking because you're going to do some real work. So what happens though, sometimes people get into the session, even with, primary care doctors, they have all these questions, their anxiety gets the better of them, or the provider starts to ask a question and they go down this road and then they forget what they wanted to ask. So go in with some information and some questions ready to go. And that's whether you're a minor or not. It really annoys me that my phone shakes. I got to find a different way to do this. Hey, Cody. Okay. Let's see. Most people who have BPD have issues maintaining relationships. Is that common? So it's a question, do they? Yes. As a general rule, I'd say yes, because of the emotional lability, those ups and downs, the emotional reactivity, the abandonment issues, stuff like that. I think that's pretty common. Definitely workable, definitely something you can overcome and improve. Possible to live with BPD without medication? Absolutely. I have people doing it. Most of them, full disclosure, most of my people with BPD are in therapy and doing medication. And it's very often polypharmacy, which means they're on more than one medication. It's a trial and error kind of period trial and error kind of process rather, when you're looking at medication, not just for BPD, but for any mental health condition, because we don't know necessarily, I mean, there are tons of medications. We don't know exactly what's going to work, and what's not. So there's testing that you can do, but yes, it is possible to live with BPD without medication. The issue becomes suffering for the sake of suffering. So when I talk to my OBGYN, I have 2 kids, when I talk to him about, like, do I take the epidural? Is it bad for the baby? Blah, blah, blah. He said something that will really stick with me about medication in general. He said, with what we have these days, the advances, all of this stuff, the way we know how to place this and so forth, he said, if you don't do it, it's suffering for the sake of suffering. Now, all kudos and high fives to the mamas who have done it naturally and didn't want the medication, didn't want anything in their system. I applaud you. That was not me. So I asked him about that. That's what he said. So suffering for the sake of suffering. I mean, that's an oversimplification. So don't come at me about it if you went natural childbirth or you don't want to do medication or whatever. But I do think there comes a time where you kind of have to evaluate, like, okay, what have I done? What have I tried? Have I given it a good, the old college try in therapy, really worked on that, overcome some trauma, worked through some issues, and am I still not feeling terrific? Then it might be time to start looking at, better living through modern chemistry, as I said. But you can find naturopathic, holistic, functional providers who do like supplements, vitamins, minerals. They look at hormones, which can play a role. And they try to treat some of that stuff first versus just jumping to a prescription. So long answer to your question there, Hope. Okay. All right. I'm trying to figure out which way I'm supposed to go with this, you guys. I'm so sorry. Bear with me. Trying to look at comments here. You're welcome, Hope. My pleasure. Okay. Attachment to one person, a bad thing. No limit, Sammy. So you read my mind. I'm actually going to do a video on the FP, the favorite person. So I'll give you guys a sneak peek. I haven't fleshed this out or gotten all my notes together yet, but I don't think it's necessarily a bad thing to have a favorite person. Okay. Now, with that being said, you have to have realistic expectations about the favorite person because they will let you down. Everyone is human. No one is perfect. It's not a good idea to put all of your eggs in one basket. I write about this in my marriage book, actually, that partners shouldn't put all of their eggs in one basket and expect their partner to meet all their wants, wishes, and desires. Way too much pressure and not fair to either one of you. So being attached to one person could be challenging, could even be dangerous, depending on what we're talking about here. So in general, it depends. Nice political answer there for you. But I'm gonna do a video about that. So stay tuned. Our mood stabilizers, usually the go-to candy. I can't speak to this technically, legally, because I'm not a prescriber. I have observed people with BPD. I did a video about this. It's called Meds for BPD, so you can find more information. But I've seen mood stabilizers used to treat some of the symptoms. I've seen antipsychotics or neuroleptics used to treat some of the symptoms, not because people with BPD are psychotic, but because we know that it helps to regulate some of the anger, impulsivity, things like that. I've seen opioid antagonists used, like naltrexone. I've seen anxiolytics or anti-anxiety agents used, antidepressants, you name it. I've seen pretty much every class of drug that I can think of used. And different ones work for different people. Like a lot of people don't respond well to the serotonin drugs, and they do beautifully on dopamine drugs and vice versa. It just depends. That's why it's that trial and error. But in general, Candy, our mood stabilizer is the go-to. That is what I see the most common, to answer your question. Someone very close to me living with bipolar and BPD, thriving with meds and therapy. Awesome, Cody. Hey, Tamaya. Oh my gosh, old friend from high school. What's up, bud? Speak my experience. Oh, absolutely. Today's the first day I have ever had someone speak my experience out loud. Thank you. You are welcome. Thought this was Julie Bowen. I'm not sure who that is. Those are like a Band-Aid that makes it worse once you rip it off, in my opinion. I'm assuming maybe we're talking about meds. DBT changed your life. Amen. I've seen it change so many lives. Thanks, Cody. Happy to see you live. Okay, relationships. So now I'm back to bipolar 1 with BPD. So that bipolar versus BPD video that I did many, many moons ago, that was the most common question is, can you have both? Absolutely, you can have both. Many conditions in the DSM are comorbid. You can have anxiety and depression at the same time. You can have OCD and schizophrenia at the same time. You can have bipolar and BPD at the same time. So they can coexist. A really good interview evaluation with a psychologist or other talented, skilled, experienced provider will help you sort out diagnosis, to be sure. But with BPD, I would highly recommend trauma work if relevant, if you have some trauma to unpack, and then DBT, dialectical behavior therapy. So DBT doesn't work for everyone, okay? I know there are some of you who have said, yeah, nope, not my lane, not my jam. I get that. And there are other ways to do like CBT, cognitive behavior therapy. There are other modalities that can be used. Me personally, treating BPD for over 20 years, I've seen the greatest relevance and experience or success with using DBT. So whatever you have in addition to BPD, start on the BPD with some trauma work and DBT. And there are self-help resources under the resources tab on my website if anybody's interested. Contamination phobia, severe OCD has a harder life than myself, in my opinion. So I'm assuming that's in response to the BPD comment. Yeah, I mean, that's what I'm saying, Ryan. You know, it's really subjective. Like, there are plenty of people with, paranoid personality disorder who would say that, their life is absolutely terrible. They don't leave the house. Like, they are hermits. They don't ever leave. And that's awful. They don't have that interaction. So it's all very subjective, right? I don't want to rank them, but BPD is definitely a very difficult diagnosis to live with. The good news is there is help. Benzo, Abigail, and I don't like it. Yeah, benzos I don't love those either. First of all, they're habit forming. Secondly, they can, with long-term use, there's some research that shows that they can contribute to depression. And then when you come off of them, some people can have rebound anxiety. Now, that being said, sometimes a benzo is the only way for someone to knock the edge off and get into a place where they can actually do the work of getting better and then come off the benzo later. So I understand if you don't like it. The side effects are not terrific. So, okay, let me go back this way. Sorry, guys, I'm trying to keep up. If I miss you, I apologize. I'm reading and talking at the same time. Probably not a good idea. Sorry, it bugs me when my phone shakes, so I apologize for that, guys. Today's the first day. Okay, I saw that already. All right, guys, I think... Hey, TJ, what's up, brother? Thank you for your comment. Are you Linda from Lucifer? Okay, I've been asked this question. Linda, the psychologist or psychiatrist from Lucifer. I don't know. I've not watched the show. No, I wish. I wish I were a movie star in addition to being a psychologist, but I am not. I've heard that a lot. And she's actually in Suits, one of my favorite Netflix shows. My husband and I are catching up on the recent episodes, and she's in there. And I'm like, babe, do you think? And he's like, I don't see it. Not really, but maybe kind of a little bit. So you're one of many who have asked me that question. That's hilarious. One-on-one session with me. Yes, message me and we'll try to sort that out. When you are the FP, favorite person, what can you do to help with the obsession? Boundaries. Is the favorite person usually a certain type of person? That's a good question. No, I don't think I could generalize that because it really depends on the person and what they're looking for. Like, my favorite person is going to have certain characteristics. Yours is going to have some. This person over here is going to have, their person's going to have different characteristics. Obviously, I think in general, if I could make a general statement, it would be that, your favorite person is going to be someone who really understands you, who doesn't judge you, who's compassionate. They are able to tolerate the emotional upheaval that you deal with. So I'd say compassionate and sympathetic, or if they haven't been through it, they're at least empathetic. Okay. All right, let me go back. Linda from Lucifer, it cracks me up. I hear that all the time. Only since coming on TikTok a few months ago, though. No one's ever said that to me in real life. Okay. Do they have issues with introspection when it comes to their feelings or realizing their actions? I'm assuming we're talking about BPD. It runs the gamut. So I find that a lot, so I've talked about internalized and externalized BPD, and then of course everything in between. In general, I'd say people with internalized BPD tend to be a little more introspective because they tend to be inward thinking anyway. But I've had plenty of externalized BPD. I've seen plenty of externalized BPD, people with BPD come through my office, and they have insight, or they're willing to gain it. If I say, if I raise a hand and say, hey, maybe this isn't working for you and here's why, they're willing to consider it. And my favorite line is, gosh, I never thought about that before. And I say, well, that's what you pay me for. All right, let's see. Recommend family of the person struggling with BPD to go to therapy. Ooh, I lost that, Candy. Sorry, let me go back. Y'all bear with me. This is all new to me. Okay, how can you make them understand? Okay, so go to the resources tab on my website under borderline personality disorder, and you'll see some books that could probably help the family members. Stop Walking on Eggshells was one that someone mentioned earlier. There's also I Hate You, Don't Leave Me. Lots of different resources out there that can help. If you guys are familiar with some resources, certainly put those in the comments to share. One of my favorite books about BPD was actually recommended by a patient with BPD, and it's called Get Me Out of Here. And it's by Rachel Ryland, which is a pseudonym, Reiland. So she's writing under a fake name. But man, so powerful. She depicts what it's like to go through treatment for BPD and what her relationship with her therapist looks like, and the ups and downs, and some of the stuff that she went through, and some of the experiences that she had before she healed and, made progress and so forth. So that's just a really vivid picture, I feel like. It's called Get Me Out of Here by Rachel Ryland. So yeah, anything, if your family members are open to it and willing to read or listen or watch some videos, go ahead, give it a try. I mean, we want all the support possible when someone's dealing with mental health issues. Ryan, thank you. You're trying so hard to get us all, and I appreciate it. Yes. Yo, bro, football on right now. Well, go watch some football, man. You don't have to watch me if you don't want to. What to do with BPD daughter who is addicted to abusive boyfriend and picks him over baby. Oh, that is hard. That is really hard to watch. She's got to want to get help though, mama. She's got to want to go to therapy and actually get help, get better. She has to recognize that she has BPD if she's been diagnosed with that. So that's largely on her. All you can do is share resources with her if she's open to it. The other thing you can do is if you encounter challenges with her BPD symptoms, then you can get your own therapy to look at how to set boundaries. Okay. All right. Oh, geez. It just jumps on me. I'm sorry, guys. Doing videos about different types of BPD. Okay. Thank you for asking this. I think it says Shannon. I'm sorry. I can't see it very well. Yeah, there are 4 different types of BPD that, I forget the theorist's name who identified it. I don't speak in those terms because when I've studied them, there's a lot of overlap. And then I feel like people with BPD aren't put neatly into 4 categories. So it's a continuum, and I speak in terms of internalized and externalized. So are you internalizing? Is there more self-loathing? A lot of times there's self-harm. And then externalizing, not to say that they don't have self-loathing or self-harm, but we see a lot more acting out type behaviors in people with externalized BPD. So I speak in terms of that continuum. But yeah, petulant, impulsive, there are 4 different types this guy delineated. And so I don't have a video specifically about that because I don't really subscribe to that. I feel like it's just too overlapping to be really helpful, but that's just me. Those types are out there. If you want to research them, go for it. You're welcome, Candy. Wait, what was the first book? Rec again. Ooh, I don't remember, but I talked about Get Me Out of Here by Rachel Ryland. These are all under the resources tab on my website, drbellingrodt.com, under the borderline personality disorder section. So there's Get Me Out of Here, I Hate You, Don't Leave Me, and Stop Walking on Eggshells. I think those are the 3 that we recommended. Thank you, Shannon, for chiming in. Walking on eggshells, yes. Can you be both? Thanks, TJ. Bye, man. I'm assuming that's bipolar and borderline personality disorder, maybe. I don't know if you just joined us, but yes, we were talking about that a little bit ago. You can be both. Many conditions in the DSM are comorbid. Y'all, the DSM is huge, okay? This book is huge. You can see all my little tabs. It's huge. Lots of conditions in here, and they can overlap. They can run into each other, if you will. So yeah, you can be both BPD and bipolar disorder, Shannon, if that's what you're talking about. So it is possible. And I would say DBT and trauma work are the go-tos. Truth to women commonly being misdiagnosed with BPD when it's actually autism. Hope, I talked about that a little bit ago. I don't know what the data are on that. I'd want to do more research. Oh, thank you, Candy. She was asking about both internal and external. So internalized and externalized. Yes, absolutely. So that's why I said it's a continuum. So they're internalized, externalized, and then there are people who are in the middle and they exhibit characteristics of both. Yes. Candy, thank you for clarifying and helping a sister out here. Okay. This is fun, you guys. Okay. I think I've gotten a lot of questions, a lot of ground covered. So thoughts on EMDR. Oh, love it. Love it. I use it a lot, especially when I was in person. I haven't used it as much virtually, though that is a possibility. But I used the light bar, and EMDR, in my opinion, is the most powerful form of prolonged exposure desensitization therapy there is. Now, not everyone can handle it. I've seen certain patients were unable to tolerate it. I think traumatic brain injury can cause some challenges in tolerating the lights. So there are other modalities you can use. But yes, I think it's huge. EMDR is eye movement desensitization and reprocessing. So the way I explain it to people is trauma gets stored very succinctly in a couple structures in the brain. Now these are vague, or these are generalizations, globalizations. So bear with me. This is just how I understand it and how I help others understand it. So two little bitty structures in the deep inside the brain: the amygdala, the hippocampus. Amygdala is emotion, hippocampus is memory. Very simplified. Okay, the deep brain structures. That's where trauma gets stored. And so what happens with EMDR is we pull up the trauma. It is not fun. Okay, it is not fun, but it is incredibly powerful. We pull up the trauma and we desensitize. So you're doing eye movements back and forth to activate the brain bilaterally. We don't know exactly how it works. And I'll tell you, when I first heard about it, I thought it was hoodoo, voodoo, whatever. Not a fan in the beginning. Then I went to the training and I was sold. So you're bilaterally stimulating both sides of the brain while you're recalling the information. And the way I explain it is, it's stored very compactly and succinctly inside the deep brain. And then you do EMDR, it brings it to the surface, and then you can't forget it. I wish we could pluck those memories out for you, but you can't forget it, but it stores it more diffusely in the brain. So then when you're triggered by, when your PTSD is triggered, however that manifests for you, you don't have as big of a reaction. So you've become desensitized. You're less sensitive to the triggers and the reaction. Quotes, we're talking about EMDR, eye movement desensitization, and reprocessing. I have BPD, mom's a narcissist, living hell for me. Ooh, whew, that is tough. That is tough. Narcissism is a very difficult condition to treat because generally they don't have any insight. So, and they're not willing to have it. I've had a few and I've seen them get better, but they were more traits or features. I don't know that they were really fully in narcissistic personality disorder. But anyway, to answer your question, I would say just focus on you, getting yourself healthy, and you're going to have to set boundaries with mom when her narcissism is showing, if you will. Trying to think what else just off the cuff. There are books you can read about living with narcissists. I don't have the names off the top of my head, but an internet search will give you a ton. You hope. You've answered more on here than 3 psychiatrists over 8 months. So glad, girl. Glad it's helpful. Motivate me to get better and help others. Amen, Ryan. Bring it. Let's do it. Thoughts on EMDR? Okay, we talked about that. Women, okay, we talked about BPD and autism, and I just want to do more research on that one, you guys. Okay, I got to find a better way to do this because I know it's driving y'all crazy that my phone is jiggling all over the place. Hope, reaching out to Candy, love it, support each other. Oh, best way to get better at procrastination. All right, let's shift gears for a little bit. Let me answer Sammy here real quick. Can EMDR help with sexual assault or sexual abuse trauma? Yes, that's what I've most used it for, is treating trauma of a sexual nature. And I've also used it to treat anxiety. Those are the big ones that I've seen. Usually trauma is where that is what that's the most helpful with. Okay, so procrastination. Boy, y'all, I could do a whole other video on procrastination. Let me give you the Reader's Digest version. Okay, so procrastination is really just perfectionism, getting in your way. So, and perfectionism is anxiety. Anxiety is based on fear. Fear is based on underlying self-limiting beliefs. The end. I'm just kidding. So it really goes back to underlying self-limiting beliefs. This is why I built training around this. Negative automatic thoughts, self-limiting beliefs. You can find those in my profile. Low-cost training to really help you understand the beliefs that drive patterns like procrastination. But basically, there's perfectionism getting in the way. So you're putting these really, whether you realize it or not, it could be subconscious, really high standards and expectations on yourself to perform, to achieve, to do a perfect job. Perfection doesn't exist, and done is better than perfect. There are a lot of CBT skills that you can learn to overcome procrastination. So I would definitely talk with a therapist about that, CBT for procrastination. I think it becomes overwhelming. So sometimes procrastination can lead to paralysis, and it's, paralysis by analysis or analysis paralysis, whatever you want to call it. But just an example, let's say you're trying to, I don't know, something simple, clear off your desk. Okay. And it's just an absolute disaster. Well, the longer you let it sit there, the more of a disaster it gets. And then you become paralyzed and you don't know where to start. Same thing with like writing a research paper or, any number of things this can apply to. Which the best thing to do is to, once you see it, start breaking it down. So break it down into smaller chunks. When I do executive coaching, I talk to people about their office because a lot of them work from home. It's a safe, comfortable space, but it gets to be a mess. It's a catch-all, whatever. We will break things down by wall or by segment on the wall or by area like desk, bookshelf, chair, whatever. So breaking it down into manageable chunks. So if we look at writing a research paper, then it's a matter of like, okay, get an outline, just kind of write things out. The other thing that really helps with procrastination is list making. I am a list making queen because if I write it down, then I don't have to remember it. So use your notes app in your phone, use good old pen and paper, use your reminders app in your phone, use your alarms in your phone, things that will help you stay structured and on schedule. So again, procrastination links up with anxiety. Antidote for anxiety is control. So build some control mechanisms, if you will, and get those in place so that you can tackle what's in front of you, and then success breeds confidence breeds success. So you're more successful, then you're more confident. So then maybe you start taking things, you start tackling things sooner, and you break out of the pattern of procrastination. So that was a really condensed version for what could probably take several sessions of therapy. So definitely get some help with that if you're struggling. Okay. Weekly planners, yes. I still am a pen and paper girl, so my planner has names on it, so I can't show it to you, but I have it's like a size of a sheet of paper, the big one, and I put everything in there. And I use alarms in my phone and reminders in my phone, so all the technology, use it. It's here for your advantage. Ooh, geez. Okay. Feels so good after you write it in. Yeah, and if you get colored pens and you like office supplies like me and you can make different colors for different things, then it can be kind of fun if you approach it that way. It's a mindset shift for sure. For some people, it's a paradigm shift because you're just totally changing the way you see things. Procrastination and laziness. Ooh, okay. Laziness does not exist. There's no such thing as lazy. This was part of another series. I'm getting all my future TikTok videos out here. I'm not gonna have any content left. I'm just kidding. So procrastination exists, laziness does not. So people can look lazy. Their behavior can look lazy. I'm sorry, let me get this out of the way. It's driving me insane. People can look lazy, but they're just unmotivated. So what it is, oh gosh, now I started a cascade, sorry. Okay. Complete the verification. Oh my gosh, you guys, bear with me. It wants to end my live because there's no activity. I guess I need to comment to get activity or something. Verification complete. All right, we can keep going. Okay, no such thing as laziness. So a person's behavior looks lazy, but they're really just unmotivated. So we change at our tipping point. When the benefits of what we're doing are outweighed by the costs of what we're doing, then we change. There has to be that tipping point. There has to be that motivation. So if, my office is a complete disaster, it may look like I'm lazy and I don't really care. Okay. But the fact of the matter is I'm unmotivated. There's not really I'm the only one who comes in the office, so nobody sees it. Well, it's not that big of a deal if it's not that big of a deal to me. It actually is. It's called the psychology of space, and that's a separate discussion. But it's just, I'm not motivated to do that. So whatever it is, and again, these are big generalizations trying to condense a lot of information into a short time here. But laziness as a concept doesn't exist. Behavior looks lazy, but it's actually just unmotivated. So you have to find what motivates you or what drives you or what's going to get you up in the morning and get you moving to do the things so that you don't procrastinate. All right, let's see. Done is better than perfect. Yep. Executive function common with BPD. Yes, there's some research that shows. So executive function is housed up here in the frontal lobe, and that's one of the areas that's implicated in BPD. I did that in my 4 causes of BPD. I talked about brain anomalies, so you can see more information about that. Thank y'all for the follows. Appreciate it. Do you know a lot about pure OCD? I've treated it more than once. It's not a specialty, but it's really just, OCD is an anxiety disorder. So PTSD is an anxiety disorder. Eating disorders are anxiety disorders. And so OCD is about finding ways to control your environment that don't involve obsessions or compulsions. That's a whole separate discussion, but it is very treatable. I've seen people get better. A lot of times medication is involved because there is sort of a chemical thing going on there that seems to trigger some of that for some people. So, medication may be warranted, but definitely coping skills and different treatment approaches can help with that. Okay. I love y'all supporting each other. That just warms my heart. Join my team. Okay, somebody tell me why that is popping up on top of my head. This is new to me. You guys are great for bearing with me here. Okay, follow. Thank y'all. Okay. All right, there's a bunch of new messages. I'm going to try to hit a couple more of these, and then I got to go build some content. So I'm going to jump off, but let's see. This is fun though. I'm glad I did this. Setting boundaries gets a bad response. Yep, it's going to, because people who don't like boundaries, and they don't like it when you set them and you have those under control. You just have to keep setting them. You have to protect yourself is the thing. OCD is quieter now, still apparent, yeah. Informative videos, learned a ton more than in therapy. Thank you. Amy or Ami? Thank you. I'm glad it's helpful, you guys. I've been doing this for a long time. Got a big old knowledge bank in this noggin, so I definitely want to share it. Hopefully you're in a state that she can treat you in. Yeah, there's just a handful of holdouts. New York can't do, Massachusetts I can't do, I think Iowa can't do, Guam, Hawaii, there are a few. Okay. All right. I wish people would voice their boundaries. Yeah, absolutely. You got to state them. Otherwise people don't know what they are. Feeling the chronic emptiness really hard. Okay. Let me respond to that, and then I think I'm going to hop off. So where did that go? Chronic emptiness. So eventually I'm going to do some content on overcoming or coping skills for the different symptoms of BPD. That might be subscriber content. I haven't decided. It's going to honestly depend on how much work it takes me. I don't know if you guys know this or not, but I still see patients 4 days a week. So I do all of this kind of stuff between patients, after work, weekends, that kind of thing. So there's a point where I'm putting in a lot of time and there needs to be a return on it. I'm just being honest, full disclosure here. So there will be some subscriber content. I don't intend to have it cost a mint. I know people have limited resources. I get it. And, I can't call it therapy, so it's not going to have the price tag of therapy. So I'm gonna address this more. But basically, with emptiness, I think what really is helpful is a couple of things: getting connected to other people, and actually it's all under one umbrella, and that is getting grounded. So finding ways to ground yourself. If that means literally walking barefoot outside on the earth, then do it. There's actually research that shows that our frequency goes down when we contact Mother Earth, for real. So that's actual grounding, and you can do that. There are grounding sheets, grounding mats, all that stuff. So you can look into that. But actually grounding yourself that way, or you can do like mindfulness grounding. So where you sit and you can take on a meditative posture where you like observe what's going on around you. You engage all five senses, and that brings you into the present. Emptiness is a feeling that we get by reflecting on life, where we're at, where we wish we were, where we should be, shoulding on ourselves, things like that. So if you can get focused in the present moment and get grounded, that will help. So getting, interacting with other people, getting in contact with other people, even if it's just a phone call or maybe run out for coffee or whatever, that can help you kind of get grounded in the moment and experience what's happening in front of you instead of thinking about the emptiness or shoulda, coulda, woulda, or I wish I were in a different place. Anything else? Grounding, people. Yeah, those are the things I can think of just off the top of my head, but I will flesh that out some more. Okay. Grounding is good, and mindfulness, yeah. Teaching yourself DBT through online self-help sites if you can't afford her. Absolutely. Yes, and there's some, there's art, again, under the resources tab on my website, there's some self-help resources that are low cost, and then you can do an online search for DBT self-help and you'll get a gazillion hits. I also have low cost training. If you go to the tab, the link in my profile, Psychoeducation Academy, there's some low cost training. There's some free training, and then training as low as $7 and then up. Okay. Take a walk outside. Love that. Frequency. Yes, you feel me, Abby. Okay. Anyone know any good online BPD therapist? I don't know how much she is, but I need cheaper. Okay. Yeah, I said earlier, intake with me is 200, follow-ups are 175. If you have insurance, you can go through your insurance and ask them to find you a provider who's versed in personality disorders or specializes in BPD or doing DBT, self-help resources. Okay. The states I can do, Ryan, I see you commenting on that. Go to psypact.org, psypact.org, and click on the map, and it'll show you the interjurisdictional map of places that I can practice. Okay. Y'all are great. Thank y'all for chiming in and giving me some questions to answer, some content. Abigail, thank you. So sweet. Okay. All right, guys, it's 6 o'clock here in Arizona, so I'm going to shift gears and go build some content, get ready for dinner, family time, do all the things. Thank you all so much for jumping on and engaging with me. I apologize for all of the technical stuff. As I said, this was my first live. So I appreciate everyone jumping in, asking questions, and we'll do this again. So thank you guys for tuning in, and I will see you soon. Now somebody's got to tell me how to get out of this. Oh my goodness. Here we go. Okay. All right. Bye guys. Thanks.